kids there had RSV. It's a good day. All right, good morning, everyone. It is almost 6 a.m. and I am headed to my first Peds Clinical with a dirty windshield. I am heading back to St. John's Hospital, which is where I did my labor and delivery. And people around here where I live think St. John's Hospital is a great hospital for children. My experience compared to St. Louis Children's Hospital is I don't think it is as good. But in St. John's defense, my kids have never spent time there. I'm only going by what other people have told me about their children's experience there, and I have had a foster baby there that I helped take care of. And you know what? It's very different for a hospital to try to take care of a baby who doesn't have the same caregiver there 24/7. And for sure, the foster baby that I helped take care of, most of the time they were in the hospital, and the stories I heard about what happened, they weren't my foster child. And then when I was in the hospital with them, they still weren't technically my foster child. It was just DCFS knew they would assign them to me, and I didn't have the ability to stay there 24 hours. I stayed there almost every day during the day, which is as much as I could juggle with my schedule, but it's not the same as a parent staying 24/7. It just, parents make a difference in the care of their kid when they can stay at the hospital with them. So, I'm a little bit comparing apples to oranges because I might have different opinions if Raylan had been in St. John's and I was always there with her, but St. Louis Children's is amazing. I did not ask if I could do my rotations at St. Louis Children's because it's an hour and a half away, and they can put you on any floor there, and whereas Rankin, I would have got experience with kids that are the exact same kind of kids I would deal with in the home. So I felt like it was worth a little bit of extra drive for Rankin, but not necessarily for St. Louis Children's. So I am going to be at St. John's. They cut our hours back to only 45, I think. I put down 4 12-hour shifts, which is actually 48 hours. So I have a little bit of give. I can duck out 3 hours early or come in 3 hours late if needed, which I think is good. But if I don't need to, I'm just going to get 48 hours in. I'm tempted to ask Elmhurst, hey, can I try to do 60? And then can you take off 12 or whatever, 15 hours in the spring on one of my other rotations? I doubt they would do that, just because if other people heard that they did that for me, how many people would want to move their clinical hours around, and it would get to be a mess. But I may ask anyways, because peds is something I'm very interested in. All through this program, I pretty much thought when I finish, I either want to go back to where I did my mental health rotation at the drug and alcohol rehab place that was amazing, or I want to do home health with medically complex kids like Raylan. Those are the two things that interest me. Labor and delivery was interesting, but definitely not the place for me. Working somewhere like a children's hospital, I don't know. It could be interesting. It could be something I would enjoy, but it's an hour drive to get to our closest children's hospital, and that's the closest place kids can be at inpatient. I don't think I want a place that far away. And probably St. John's would only want to hire a new grad as a full-time nurse. So I don't really think this is an option for where I would work later. But I wouldn't rule it out like I would rule out labor and delivery. So we will see. I have rambled enough. All you are able to see right now is boring country roads. So I could switch to me, but you can't see me because I'm driving in the dark. But yeah, it'll be light out by the time I get to the hospital, and it will be light out probably when I leave the hospital, but it will be dark by the time I get home. It's a beautiful day outside. I will enjoy it from the confines of the hospital today. I hope you guys get out and get some fresh air. I hope my kids don't stay glued to screens all day and they get out and get some fresh air. I will update you and tell you all the wonderful fun I had at clinicals when I get off.
Later.
Hey everyone. I finished my first peds clinical, and there's so much less drama on the peds floor than the labor and delivery floor. And you know, I doubt it has anything to do with labor and delivery or peds. I think it's just it takes like one grumpy person to kind of run a group. And I was just with a really good group of nurses today, nurses and techs and charge nurses and doctors. Everyone just worked well together and was so nice. So that was nice. There is a national crisis, a shortage of hospital beds for peds, and I can tell you guys the cause of it. It's RSV. Oh my goodness. So many kids there had RSV, and that takes up beds. That takes up intensive beds, ICU beds. All my kids were on intermediate PICU, like intermediate step down from the PICU, and one of them got transferred to PICU. I saw 5 different patients today. Nurses in the intermediate PICU usually get assigned 3 patients. My preceptor had 3 patients, but one of them had COVID, and she's like, just stay out of that room, which technically we're not supposed to work with COVID patients. So I was like, that's fine. And then she got 3 new ones. But yeah, RSV is bad, guys. And they were moving teenagers out of the children's floor so they could move in more little ones, because teenagers are almost grown-up size, or they are grown-up size, so it's easier for a regular floor to know how to take care of them. But biggest thing you can do, sneeze in tissues, wash your hands, don't touch your face. If you're sick, stay home. Because yeah, people are waiting in the ER a long time to get beds. One of the moms said, this is in the middle of Illinois, and she was told, well, you can wait here in the ER, or we can send you to St. Louis Children's, which is like, I think 2 hours away from Springfield, or Peoria, which I think is an hour away from Springfield. And they chose to wait in the ER because they lived close to Springfield. But yeah, it's not a good time to need a bed. Like, if Raylan were to get sick right now, I think if I called the on-call, they would do everything they could to keep us at home, because there's just not many beds. And if she was sick enough to need to be at the hospital because she got her respiratory stuff, she would probably be in the PICU, because she'd probably need like BiPAP or something, which is a non-invasive ventilator. But I love my preceptor. She's nice. She doesn't really expect a lot from me. I'm fine with that. She does let me watch and learn. I don't feel at all like she minds me asking questions. She tells me stuff. So it's not so much a, hey, prove you can do this, which I have had preceptors be like, okay, we're gonna help make sure you can do things, which it's good to practice like skills and charting and stuff, but I'm probably not going to use Epic charting. I like this preceptor. She's making sure I know what she's doing and why, but she's trying to get her job done quickly, so she's mostly doing stuff herself. But like, I assessed, I listened to breath sounds, and I just be like, I heard this, is this what you heard? She's great. I'm learning a lot. And yeah, only 3 more peds rotations, and then I'll be done with peds. It's gonna fly by. But yeah, it was fun. I could see myself working on a peds floor at a hospital or at a children's hospital, but I really don't think I will. I would not want to work at this hospital just because, so it's a children's hospital, but it's really like a children's wing of a hospital, and these nurses have all the kinds of peds patients. They have cancer patients, they have sickle cell patients, they have med-surg patients, they have RSV patients, they have neurology patients. Whereas if you go to a big children's hospital, you get assigned a floor and you have like all cancer patients, or you have all patients that have neurological issues, or you have all patients that have surgery recovery, or all cardiac. And I just think that allows you to give better care. It allows you to be more specialized. These people make less probably than what they make at the bigger hospitals, but they have to know more. It's kind of like, it's not very fair. So I would not want to work there. I feel like they have to learn so much, and they just can't provide the quality of care that St. Louis Children's can, where the nurses can be more specialized in what they're doing. But really good work environment, really friendly, and that matters. I mean, that matters a lot for a job. But I'm gonna enjoy my clinicals. 1 down, 3 to go. It's a good day.